Bronny James, the son of Lebron James, actually had a cardiac arrest yesterday while playing basketball. He's only 18 years old. He was taken to the intensive care unit, but is now, thankfully, in stable condition. The incidence of sudden cardiac death among young athletes is overall pretty low, around 1 in every 75,000 young athletes per year. Being a young athlete, he is of course someone who's overall very healthy, so why did he have a cardiac arrest? Well, there's about 7 main causes of sudden cardiac arrest in young athletes. Sudden cardiac arrest is the sentinel event of an underlying previously undiagnosed heart condition when a person is put through rigorous physical activity. I've had several young patients who've experienced sudden cardiac arrest while exercising. What Damar Hamlin experienced, the NFL player with the Buffalo Bills, he had commotio cordis, which refers to the sudden arrhythmic death caused by a blow to the chest. And that traumatic impact occurs at just the right moment to trigger the heart's electrical conduction system to go haywire. It's very rare, but it happens. And if their heart stops, they need immediate CPR to bring them back to life. In the case of Len Bias, who was an incredibly talented player for the Boston Celtics, he was actually the number 2 pick in the 1986 draft. And less than 2 days after that, he died as a result of cocaine intoxication. He was just 22 years old. And there have been other case reports that described sudden cardiac death in young athletes who had previously known heart disease, but they were taking androgens for performance enhancement, and they were found to have enlarged hearts at autopsy. But most cases of sudden cardiac arrest in young athletes do not fall into the category of steroid use or cocaine use or even commotio cordis. There are several different arrhythmia syndromes that some people are born with, and the heart is usually structurally normal in these cases. Essentially, the electrical wiring of the heart is a little off. So examples in this situation would include things like long QT syndrome, short QT syndrome, Brugada syndrome, early repolarization syndrome, and catecholaminergic polymorphic ventricular tachycardia. And another thing to think about is energy drinks, right? Because many athletes use energy drinks. Those who have an underlying heart condition, especially when it comes to their electrical system, they're more susceptible to those caffeine and energy drinks. Myocarditis is another possibility. Myocarditis is inflammation of the heart, and sometimes there's no obvious cause of it. For example, Hank Gathers was a basketball player who had a sudden cardiac death while playing a game, and the autopsy reports revealed that he had something called idiopathic cardiomyopathy with residual interstitial myocarditis. Idiopathic means no known cause. Another potential cause would be something called ARVD, which is arrhythmogenic right ventricular dysplasia. And this is a rare form of cardiomyopathy in which the heart muscle of the right ventricle, and sometimes with the left ventricle, it's replaced by fat tissue. So the muscle ends up being replaced by fat, and also scar tissue is what replaces the muscle. So basically the right ventricle becomes dilated and weakened, and it does a poor job of pumping blood to the lungs. And normally the blood in the lungs is what's picking up the oxygen, and that ultimately leads to the left ventricle not pumping as much blood to the rest of the body. And as if that's not bad enough, the right ventricle becomes more prone to developing deadly arrhythmias like ventricular tachycardia and ventricular fibrillation. Although the cause is not known, AVRD, it does tend to run in families, and it's best diagnosed with a cardiac MRI. Another cause of sudden cardiac arrest in an NBA player was famous Pistol Pete Maravich, who he had a sudden cardiac death while playing a basketball game, and this was due to an anomalous origin of a coronary artery. So the coronary arteries, they pump the blood from the heart and back to the heart. So it's essentially going in a circle. So if there's a problem with those coronary arteries, whether it's a plaque inside them or you're born with anomalous pattern of those arteries, that can lead to a sudden cardiac arrest. Last but not least is hypertrophic cardiomyopathy, or HCM. And this is actually the most common cause of sudden cardiac arrest in young athletes. This is what happened with famous athletes like Reggie Lewis, Miklos Feher, and Mark Vivian Foe. So in HCM, the heart muscle, it enlarges, which people think, well, when the heart gets bigger, that's a good thing. But that's only a good thing when you're talking about an athlete who builds up their muscle over time through conditioning. Otherwise, in HCM, hypertrophic cardiomyopathy, when that muscle is getting bigger and bigger, that's actually a bad thing, because you end up, the way that it's structurally enlarging, it actually develops the blockage of blood flow within the heart, meaning the heart can't get out of that left ventricle as easy. So that ends up being a bad thing. An echocardiogram, which is an ultrasound of the heart, can usually make this diagnosis, but sometimes the diagnosis does require a cardiac MRI. Now, in the case of Bronny James, he's going to be evaluated by cardiologists to figure out the exact cause. And in some cases, it can actually be really hard to figure out, because there are some conditions that are not easily picked up, even with a whole barrage of testing. But hopefully he recovers quickly and that they can get to the bottom of it as soon as possible.